Good afternoon, ladies and gentlemen. My name is Dr. Sanjeev Taneja. I'm a practicing ophthalmologist and associated with Apollo Spectra group of hospitals. I'm a practicing eye surgeon at Apollo Spectra, Karol Bagh. The topic for discussion today is cataracts. Cataract is such a common problem, but still, before going to the treatment modalities and what cataract is, I'll just briefly touch upon what cataract is. Cataract is the clouding of the normal lens which we have in our eye, and this lens is normally a clear lens, but as we age, or if we are harboring any diseases like diabetes, hypertension, or on systemic steroids, then the clouding of the lens becomes a problem, and this clouding or opacification of the lens is known as a cataract. Once the lens gets clouded, the vision starts getting hampered, which may interfere in our day-to-day activities, and depending upon the lifestyle of the person, the hindrance may be very early in the stage, or in elderlies who may not be having a very active lifestyle or requirements like nighttime driving or very active lifestyle, the cataract problem can can also manifest in a later and in a later date. So young people, basically what I want to touch is that in young people, even an early cataract can cause visual problems, while in elderlies, one may carry on with the normal lifestyle until unless the cataract starts progressing and starts giving problem. Now, the treatment for cataract is just surgical. There is no medical treatment for cataract, meaning that there is no drops, there is no oral medication which can remove the cataract. Once the process of cataract starts, that is, once the lens starts getting opacified or clouded, the only treatment that is available is to remove the cataract and clear the vision. Now, in early days, when the cataract was treated, it was when the treatment modalities were very remote or very primitive. In that stage, just the cataract used to be removed surgically and be replaced with thick glasses. But over the years, over many years, the things have evolved, things have changed, and now cataract surgery has become one of the most sophisticated and most advanced procedures in the surgical world, and especially it has come under daycare with minimal cuts, with very fast recovery period and no overnight hospitalization. The treatment for cataract is purely surgical, and two important things which we have to consider in cataract procedure is, one, the treatment part, and other is the visual rehabilitation part. Conventionally, the cataract used to be operated, we had to give a big cut, something like 8 to 10 millimeters, remove the lens, and once we remove the lens, we replace it with an artificial lens which is placed inside the eye. This artificial lens is of a material which is inert, and the big cut, that is around 8 to 10 millimeters cut, which used to be given, used to be closed with stitches. But as the things have evolved, from this conventional cataract surgery, we have come into an era of minimal invasive cataract surgery, or a sutureless cataract surgery, or a bladeless cataract surgery, in which we have done away with such big cuts. We have reduced the size of the cuts. The procedure of removal of cataract has become much more simplified and much more sophisticated. So we can remove the cataract through a very small cut, maybe up to a size of incision size of 1.8 millimeters or 2.2 millimeters. This technique involves usage of phacoemulsification or ultrasonic power, in which we give a small cut in the eye after working up the patient, testing all the modalities, doing a general systemic examination, ruling out any focus of infections. Once we have worked up the case and we have taken due clearances if there are any underlying medical issues like diabetes or cardiac problems, or the patient is on blood thinners, once this is through, we take the patient to the OT where the cataract surgery is done through a microphaco incision or a minimally invasive incision. This incision usually varies depending upon the comfort of the surgeon or the machine setting, something like 1.8 millimeters or 2.2 millimeters. In this, the cataract surgery, the lens is removed and the entire procedure is done under local anesthesia. Once the lens is removed through a procedure which is known as microphacoemulsification, in which the lens which is removed is replaced by an intraocular lens of a pre-calculated power, so that later on the requirements for glasses are minimized. The lenses which are implanted inside the eye are broadly classified into three categories. They are monofocal lenses or multifocal lenses or EDOF lenses. Monofocal lenses are conventionally which are the lenses which provide a clear vision for a particular distance. It could be either distance part or the near part, because most of us have a vision requirement, a clear vision requirement for distance. So most of the cases we put in a monofocal lens which gives us a clear vision for distance, and we might have to use reading glasses over the operated eye to have a good near vision. These lenses are known as monofocal lenses. The other type of lenses which are used are the multifocal lenses. The purpose of multifocal lenses is again to reduce your dependence upon glasses post-operatively. Multifocal lenses involve formation of implantation of lenses which have multiple rings in the form of which are focused at different points. So these rings provide us a fairly good vision both for distance and near work, but maybe for very fine distance work or near work, glasses might be required. Like with every technology, there are certain benefits and certain drawbacks with multifocal. Whereas monofocal lenses provide a very clear distance vision, multifocal lenses on the other hand provide independence from both near and distance vision, but they might be uncomfortable for people who have a very active lifestyle in the form of nighttime driving, lot of work involving in bright lights, because multifocal lenses can give certain amount of glare which might be disturbing to some people and they may not be able to adjust to it. So multifocal lenses become a good choice for of lenses or implants for people who are not too visually demanded and are not very happy using glasses. But as the techniques have modified, as the evolution has taken place, as the technology has advanced, new kinds of lenses are available which are known as EDOF lenses. These lenses don't have any rings, they don't have any nighttime glares, and they provide a fairly good vision both for distance or near about completely for near. This is a new technology as far as the type of lenses goes, and they bypass the problems which are faced by multifocal lenses users. But as it is a surgical procedure, and once the lens has been implanted, it is very difficult to remove the lens which has been implanted if the patient is having any vision related issues in the post-operative period. So a very good counseling or a thorough counseling or a thorough workup is required before we plan for the kind of lens which we are going to implant in the patient. This requires a thorough open discussion from the point of patients and what are the expectations of the patient. For somebody who has a very active lifestyle, involves nighttime driving or a lot of work in dim light, a monofocal lens would be a better choice, or instead of a multifocal lens. EDOF provides a fairly good choice over multifocals, but yes, definitely multifocals will not be required in this kind of condition. For older people who are mainly homebound or don't have a very active visual requirement, their work or their activities don't involve a lot of nighttime work or work in the dim lights or in glare of lights, a multifocal works out to be beautifully, because they can do most of their work without glasses for distance and near. In these lenses, of the two, monofocal lenses are the normal lenses, while multifocal and the EDOF lenses are considered in the category of premium lenses, because besides providing the vision, they take care of other aberrations or other refractive phenomena which might be associated with other monofocal lenses. The new kid on the block in microphaco, once we have done once the surgery is done, in the recent past, new techniques, new developments have taken place in the field of cataract surgery, and the most important being a laser-assisted cataract surgery, or a flax or a femto-assisted cataract surgery, which is commonly being marketed as a robotic surgery. See, the basic procedure in cataract is removal of the lens. Now, if you do it manually or through lasers, changes the technique. In a robotic assisted cataract surgery, the cuts which were initially given with blade in unconventional cataract surgery, microincision blades, we use lasers to give those cuts both in the cornea and in the lens. The end result is that the cuts are much more precise and much more regular, and the ultrasonic power which is required to emulsify the lens in a normal conventional cataract surgery is reduced when we do a laser assisted cataract surgery, because the cuts in the lens are also given with the laser. Now, many times people want to know what is the aftercare. Is it cataract surgery? Is it surgery in which we have to be bound to the bed, or we have to be restricted to we have to have restricted activities? See, cataract surgery is a daycare procedure. Most of the insurance companies cover it under as a daycare procedure, and even we need not have an overnight hospitalization. Normally, before the surgery, a certain basic blood test, investigation and viral markers have to be done, and once the patient has been worked up, the kind of IOL which has to be put is sorted out. Certain pre-operative medications are started maybe 1 or 2 days before the surgery, depending upon the patient's comfort, depending upon the surgeon's comfort. And on the day of the surgery, the patient is usually called 1 to 2 hours prior to the time of surgery, is made to settle down in the hospital, and the paperwork is completed. The surgical procedure takes anything between half an hour to 45 minutes. It is done under local anesthesia. No full anesthesia is required, and the patient is fully conscious and awake during the procedure of the surgery. Once the surgery is done, it is a painless procedure. Once the surgery is done, a dressing may be given or may not be given, depending upon the comfort of the surgeon and of the patient. If the dressing is given, it is usually given for maybe 7 to 8 hours or over 24 hours. Next day, once the dressing is removed, the patient is started on certain eye drops, which initially have to be put very frequently, maybe 6-8 times a day. But as the healing takes place, and as the eye clears up, and as the post-operative inflammation clears up, we reduce the frequency of the drops. But normally, in a course of post-operative course, drops have to be given for 4 to 6 weeks. Initially, for week to 10 days, certain restricted activities have to be followed. That is, not to go out in public crowded places, not to go out in a place where there is a risk of catching infection or risk of any injury. Activities like swimming and active outdoor market activities, or especially for ladies, any cooking activities have to be restricted, or playing with children have to be restricted, so that you may not injure your eye. Once week 10 days have passed and everything recovery is taking place, then we get slightly lax with the precautions and do away with certain restrictions and reduce the frequency of the drops. The eye being a very slow healing organ, the healing takes place almost like 4 to 6 weeks after the surgery. So the medication has to be continued for this long, and if any power has to be given to the patient, that is usually given 4 to 6 weeks after the surgery, once the healing is complete. Many patients don't require glasses because their visual requirements are fulfilled by the lens that has been implanted, but some patients may require glasses for very fine work, which may be either distance or near. If the cataract is present in both the eyes, usually it is best to operate both the eyes individually, separately, so that a complete visual rehabilitation takes place. So over the years, in a nutshell, what I can say, over the years, the things have advanced drastically from a cataract in which the lens used to be removed and thick glasses used to be given, to a technique which now involves just a cut of something like 1.8 or 2.2 millimeters, a microphaco, with a very fast visual rehabilitation. We at Apollo are doing all kinds of surgeries, and we have a fairly satisfied, we have a largely satisfied population, post-operative population, who are confident in referring patients to us and in getting the procedure done at our centers. Thank you so much.